Welcome back to Health Policy Off Script. I am Matthew Hart from Longwoods. And when I woke up this morning, I was a little bit older than when I went to bed last night. Well, so are you. What healthcare services do we have to look forward to, or dread, as we age? Let's find out as I hand over today's conversation to Ivy Bourgeault and Stephen Lewis. Ivy, looking forward to the discussion.
Thanks so much, Matt. And I'm really pleased to have us joining with us, Damien Contandriopoulos. He has a wide and varied background, bachelor's in biology, master's in anthropology, PhD in public health. Previously, he was a professor in the School of Nursing at the University de Montréal, and now he's a professor and associate director of graduate education at the School of Nursing at the University of Victoria. And his main areas of research focus on health policy making, using evidence in decision making, and nurse-intensive models of healthcare delivery. Welcome, Damien.
Well, thanks a lot. I'm happy to be here.
Let's hop to it, because we're really trying to talk about the morass that is older adult care. We hear of all the challenges: limited access to care in the home, long waits for specialist care or a place in residential care, languishing in the emergency department, perhaps having no access to primary care, and all of it uncoordinated. We know that you worked and lived and studied in Quebec and BC. And what would you say are some of those key differences in provincial approaches to senior care?
Interestingly, though, like the way Canada organized its healthcare system, provinces have lots of leeway. So you could expect to have quite a bit of a difference between like Quebec and BC. However, similarities are much more obvious. So both provinces, about the same proportion of people not having a family physician, the way you get access. So in theory, there is a system. In reality, it doesn't really work. So it's mostly part of luck, part of having the right connections, being, wealthier and more educated, strongly correlated with having better access. Same level of hospital challenges, lots of elderly people being stuck in hospitals not knowing what to do, if people not being able to get back home. Formulas used are different, but the principle is the same. People are going to get access to services based on a mean-tested formula. So the way our system works is that if someone reaches the age where they need long-term care and they are lucky enough to actually get a bed, which isn't a given, they're also going to have most of their available income being used to pay for this. So the notion that, it's a public system that you don't pay for absolutely does not apply to long-term care. And the last thing is very different systems for providing home care. The way it works is also interestingly similar in that for home care, what matters is not what the needs are. What matters is how much resources there is.
It's a fact of life that older adults will need more healthcare resources. I mean, that's just a fact. Why don't we do a better job at structuring care around those who are actually really using it?
Is it an older adult senior problem, or is it a healthcare system problem? And it's definitely the later. All the data from all healthcare systems across the world show the same trend. It's a small group of people who consume most of the resources, and we probably all know this. But it's still important to remind ourselves this, because that's the goal of the system. It's not a glitch. That it is what it is designed to be. It's an insurance system. So, if a bus runs you over, you are going to be a tremendous expense to the healthcare system because you need it. If you have a cancer, you need it. And there is an extremely strong correlation between age and use of resources. Humans, on average, they are expensive in the first couple of months after they're being born, and if they're lucky. If they're not, could be a couple of years, then you tend to be inexpensive for quite a while. And as you get older, there is like a very steep curve of, every year, the average cost is higher. And in that way, it's not that older adults are a burden. It's the healthcare system job, to a large extent, is to provide care to people who needs it, and older adults needs it more. Every policy analyst, Ministry of Health analyst, researcher have been warning, hey, be careful. We have a big demographic group of post-war baby boomers that are going to get all older at about the same time, and it's coming, and absolutely nothing was done. The question why, I think it's really a refusal to act. And my own understanding of the why the refusal to act exists is because what would have been needed was running completely against the mainstream ideology of our society in the last 30 years. We spent the last 30 years in an ideological position where the mainstream discourse was lower tax are better. We need to stop spending. Private sector will do the job, and individual responsibility is what matters, which to me is a complete pile of nonsense.
And
But
doesn't really work for older adult care.
Damien, I'm intrigued by your analysis, and I agree with you on the general political culture. But it's still, even on self-interested grounds, if you want the health system to have as small a footprint as possible, and you want the burdens on the state to be low, it's still in your interest to design the system to be cheaper, which would also be, in many people's views, better. Do you think it's just ideology, or do you think it's just bad math?
I don't have the definite answer on this. I do have opinions though. I would say at a sociological level, I would oppose on the one hand what you described, which would be a rationalist view of society. You know, governments are going in a very rational way to assess better options and plan accordingly. My understanding of ideology isn't as rational. Ideology to me is having rules of behavior that aren't based on this would be a clever option and this would be, a worst option based on the hierarchy of all options ranked from the best to the worst. Ideology to me is doing stuff based on almost random rules, the rules that you just take for granted. It's a cultural system of just believing something. And I agree with you. If you look at, the average gain for society, so, using resources in a wise way, making sure that most people get the care they need, and trying to optimize something. Sure, it would have made sense. However, I do think that our ideological system is not based on that notion of optimizing the average care that people get. And I do
Is
think
it
that,
just in healthcare, though? I mean, we wouldn't tolerate something analogous in the public education system.
wouldn't we?
I don't think so, because we are much less likely to want to keep putting more money into it. You can't have a system that refuses to be needs based. There's been a lot of evolution towards trying to do a better job for kids with special needs and so on. But in healthcare, we will go for the most expensive and in many ways least effective approach to doing things.
The way it is distinct is that dysfunctions are more obvious to everyone. I do think that dysfunctions that we see in healthcare are present in other big public sectors. Look at, social benefits for the poorest in a society. It's been totally dismantled. I live in BC. Desperation of the homeless crisis is absolutely unacceptable. Our education system are crumbling down. You can drive in Quebec, there's basically not even a road anymore. It's mostly just potholes into potholes. I would say, the trend, that ideological trends towards governmental self-destruction is present everywhere. But in healthcare, because it needs to run 24/7, because everyone will notice, because it deals with like life and death situation, it has become front and center in our media agenda, political agenda.
So, this ideology, I would agree, it cuts across a variety of different sectors. I can also attest to the potholes leading to potholes, driving in Quebec at times. But yet, there are some pockets of innovation. There are some pockets of really good care. It's not the norm. So, how is it that they can get that done? Most older people want to live in their homes as long as possible. How do we do that? That's more upstream, investing upstream rather than downstream, where it's much more costly.
Yep. And that's an excellent question. I would love to be confident to know the answer. I don't
Mm.
think anyone fully does. I know tens of policy analysts in healthcare trying to source, like, why is that system so hard to transform? Why is it moving so slowly? Why is it so conservative at the core? Part of the answer is kind of simple. If you have a system that is consistently starved of resources, it has been like our hospital systems have been under funding constraints for at least 30 years, and always working on the edge of what is feasible, always under implementing new cuts. And an organization that is constantly understrained is going to have a hard time innovating. At the same time, if the demand is growing, it's going to make it even worse. And if you want to pile over this, the notion of constant reforms. So, and I would
Mm.
really want to dedicate those nasty sentences to Alberta and Quebec, who totally leads the way in being the most awful provinces when it comes to constant reforms. But we also have been doing this. Governments being elected to change the system, and it just like rolls out nonsensical reforms that clog the system and prevents it from innovating. So you have it's under underfunded, it's under pressure from demand, it's under pressure from government, and so innovating in that context is not easy. So that's part of the answer, but it's not a full answer because we also know stuff that works, that exists, it's well documented, for which we have the evidence, and nothing happens. That part is probably, at least in part, explained by, again, stuff that isn't rational. It is self-interest, it is interest group, it is a system that has lots of veto points, and so a system where making changes only works if you have a very strong and broad acceptance of the change, and that doesn't happen often.
And
Are we going to see lots of change, rapid change, innovation shortly? I would love to see it, but I don't have much faith in that.
And you mentioned earlier, Damien, that healthcare for seniors really depends on their income. So if you are wealthy enough, and you don't have to be terribly wealthy, but you can buy private care in the home. You might be getting some public, you might add on some private. You might pay what is really an exorbitant price for retirement homes. And I think that this is something that people do not know. They think that that's an option, and it really isn't an option for many. And as you mentioned, long-term care is not free. It is indexed to your income. So you still pay for that. And if you are also lucky to have family and friends that, can be conscripted into care, often at their own financial and personal well-being burden, this is a real challenge. So is it that the folks who are the wealthiest and have the more options, prevent some of the change? Or is everybody, regardless of whether or not you can purchase these other additional forms of care, is it just universally bad for everybody?
So I will put my Stephen hat for a second. If we were rational, it makes no sense to think, oh, the wealthier in the society are just going to push for policies where they can pay for themselves and leave the other hang dry. It doesn't make sense because it creates a system where the prices of everything are going to be sky high, and that is going to affect everyone, including the wealthiest. So even
Mm.
if you were a fully like self-interested, egoistical, wealthy person, it wouldn't make sense for you to push for policies where it's private free for all, unless you're a billionaire. But there are British not that many billionaires like voting. So it's not like we vote for things that make it
Well, it's not
like
so much they're voting, but do they lobby?
they
Are
do.
their voices heard more by certain political parties, certain, people in positions of power making those decisions?
Yeah, totally. And again, we're going to go from rational expression of preference, political preferences, towards ideology and how ideology and political preference intersect. So one thing that I want to get back to, when we think we have a universal healthcare system in Canada, we have a universal healthcare system to the extent that everyone is entitled to the care. So that's one part of universal. But the other part of universal, which would be how comprehensive it is
Mm.
awful. You don't have dental services, right? In Canada, you have basically nothing in terms of dental. Well, people are going to need dental services their whole life, but when you get
Hmm.
older, it's going to be more expensive and more extreme. And it can be a huge drain on people's resources. Same thing for glasses. Because if I remove my glasses, I don't see anything. When we think about healthcare, we tend to think, oh, can I go to the hospital? Can I go to the doctor? Yes, you can. But the rest, we have really a tiny little basket. We could do much better. Some places do much better. So why is it the case? I would again tend to think that people do not understand what is a good healthcare system. People do not connect the dots when they vote for a political party that say, axe the tax. They don't
Hmm.
connect the dots with, oh, that means you are not going to get care because basically you're refusing to pay for it.
But can I just get in here on the politics a bit again, Damien?
Hmm.
Because there are substantial numbers of elderly people who are really in rough shape. They're on marginal incomes, even if they're not officially below the poverty line. They're probably going to be suffering more directly the food price increases lately, et cetera, et cetera. But the other reality is there is a huge concentration of wealth in baby boomers, and that will keep going through. We end up with a politically non-powerful group of people who are really suffering. And then you have this middle class and up cohort of elderly for whom the failures of the public long-term care system don't really matter much. Just bypass the public home care system. They just hire their own because it's so complicated to get public home care and so on. And therefore, the political impetus from this group seems to be divided. That's my hypothesis.
Hmm.
I
Hmm.
talk to seniors groups and I say to them, if you just mobilized, you could probably get something that looks more like Denmark over time than we have now. But I don't see any mobilization. I don't see the elderly who are quite well organized clamoring for a reversal of how we do this. So, what do you think is going on there?
It is, again, a question that I've been grappling with for decades now. Given all the evidence we have, which is a huge pile, on the best, most effective, and most efficient ways to organize care provision in order to suit the majority of the population. We have very strong evidence about this that all points in reasonably convergent directions. And at the same time, we have almost no political parties offering to do this. When you vote in an election in Canada, whether provincial, federal, how many political parties put forward notions that, we're going to try to build a better healthcare system that makes sense, that is going to involve a significant evolution in what is being provided and how? That political option is not on the table. Why is it so? And one could say, well, there is no demand. I would probably argue towards things that relate to interest concentration. So basically, are in a media ecosystem where most of our media belongs to billionaires. And if there is a tiny, tiny little group in our society that really has no interest in the society moving toward a better healthcare system, it would be billionaires. Because if you think about it, where is the money? Where it is in their pockets.
Yeah, so just to pivot, yes, there's challenges with, our taxation system and how that gets, put into the right forms of care. I think it's really important to note that, even those folks who pay, for the care, they're not necessarily getting better care for what they pay for, right? There's this assumption that, if you pay for it, it's better care. And I don't know that the data are actually there to support that. And as you were highlighting before, the answer is not just in us in policy circles, making a stronger case, mobilizing the knowledge that we need to act. There are issues coming up because it has fallen on deaf ears. So how do we turn this around? How do we pivot into getting better care for older adults? And according to Stephen's hypothesis, then we would get better care for others.
Huh. Do I have the permission to be slightly radical? Uh,
Absolutely.
um, so about 200 and something years ago, French philosopher, well known, famously said, when the poor have nothing more to eat, they will eat the rich. And this is the origin of what became known as, the anti-capitalist motto, eat the rich. I wouldn't go as far as saying like eat the rich, in part because
I
I'm a
don't know that they'd be
vegetarian,
that
so I
tasty
wouldn't
anyway.
advocate for this. But I would definitely argue in favor of taxing the rich. And I would like we can talk as much as we want about more efficiency. And as someone who is a health policy analyst of a certain age, and I've spent, again, lots of years touring conferences saying, oh, we need to be more efficient. We need those innovation, which I still think it's true. But at the same time, it's also a trap. The more we emphasize a role of efficiency and innovation, the more we also refuse to engage with, well, but we also need more resources. It is unescapable. We can innovate and increase efficiency through the roof. The amount of unmet needs currently requires more resources. So tax the rich. And
But when you tax them, how do you know that that's going to go into the types of care that are needed, that are high quality, that are efficient, etc.? So taxing is one part, right? But you have to have both hands clapping.
it becomes a question of what proportion of the investment we're making are, quote, wasted. Wasted
Mm-hmm.
because we pay some professionals too much. Radiologists, average billings of a radiologist in Canada is about 1 million per year. That's a very high cost for a professional, right? So can we label this as a waste? Could we have radiology for less money? Probably. Canada pays its drug over the average for a bunch of reasons. Could we lower prices of drugs by being more clever in our policies? We definitely could. There's that federal pharmacare plan that was floated and then that was just like munched down by interest group to being almost meaningless. So is there a part of our investments that are wasted by not being very effective ways? Yes, there is. Can we
Mm-hmm.
solve problems by being more effective, more efficient? Yes, we can. But my point would be in any large scale system that is hundreds of billions of dollars in size, there is going to be some waste.
It's not so much about waste, it's about where are you going to invest. And I know we talk, and Stephen mentioned a bit, other countries seem to be doing that better. Is it just that people, older adults in other countries have been socialized into having certain expectations and that's what they get, and older adults in Canada are not just socialized into having much of any expectation, in terms of the care? I mean, there's some really innovative approaches that seem very humane and cost effective in other countries, but we don't seem to, have that kind of inspiration here or expectation.
Yeah, it's part socializing. It's part also every time we contrast countries, there is a natural tendency that always emphasizes the problems we have and the solutions others have. And we tend
Mm-hmm.
to understand and appraise the amount of problems that exist out there. I just want to lower the
But
expectation.
is that
No,
that we all tend to have a tendency to complain about things, right? I mean, when you ask
there it
people
is.
how are you feeling, right? I mean, although they might initially say we're fine, but then you get into the barrage of everything negative happening to them. So yeah, I mean, self-report can be challenging, and different cultures will self-report in a different way. But I'm just wondering, like, have we just made the expectation so low that people are not even seeking to have something that, may be quite normal in other systems?
In part, yes. Other ends, I would say, if you talk to anyone who is still in the good health but getting older and you talk about them, I haven't met anyone who feels like things are okay. I haven't
Mm-hmm.
met anyone who say, "Oh yeah, sure, I'm be happy to go in whatever long-term care option my government finds for me and then just die peacefully." People are angry, people are anxious, people are unhappy. And so I would say there
So
is.
why haven't we been able to transfer that energy into action, into protest, into something? Like I'm curious about that.
My own explanation is partial, but I still think that Part is ideological brainwash. So just not being able to figure out that something else is possible. In order to
Hmm.
change the world, you need to be able to imagine how it would be. And this is the ideology that we have in our head and that prevents us from seeing what could be different. So that's one thing. Obviously, there is also the fact that, as I said, we live in a media ecosystem that is owned by billionaires who do not like social leftist politics and who are going to put a strong lid on any different ideas. So there is also like a limited space for people to realize what could be possible. And this is what I think um, is probably the biggest lever for change. Trying to open people's eyes and ears to, oh my gosh, could be different. And to emphasize what you've been asking, like, yes, there are things that look amazing elsewhere. Among well-known examples, Orgs in the Netherlands, so that a small it started small, now it's big, but it's a system for which nurses self-organize to provide home care services on a neighborhood by neighborhood uh, basis, and it's there is no management. There is no like ministry said. It's really the nurses that just organize how they are going to share the work to provide the care to the people they are in charge of. And if you ask, all the indicators are glowing. Residents are happy, nurses are happy, it costs less, it produces more care. It works, it has been proven, and now it turned into a big company, and they're offering care in multiple countries. It's a success story. Does it exist in Canada? No, it doesn't. Why? I don't know.
Well,
But
hold
we
on,
are,
Damien, because in some ways we are. I mean, you
are we?
presented a pretty nihilistic picture of our imagination, but we got universal childcare in this country that's made a big difference. We have made at least some movement towards dental care in this country. Would you suggest that the federal government make a commitment to a proper home care program as a real stab at an upstream kind of investment and to at least try to negotiate some bilateral agreements? Would that be a smart step to take?
If you look backwards, that was the approach that really allowed Canada to make progress, right? It is the hospital insurance system being federally led and then provincially adopted, so for sure. And you can still see, for example, when some provinces went rogue, I'm talking about Quebec, and allowing people to, like, allowing physicians to just illegally bill patients in like a Wild West approach. It was the federal government under Jane Philpott to just say, like, it's over, guys, unless you abide by the rules, we're going to cut your money. And then you see the province backing down and just saying, okay, we'll just abide by the rules. So I totally agree with you, Stephen, on a federal government that would take the leadership and move towards trying to push provinces in the back to move in the right direction would make a difference. However, as we've seen, it's not that easy. The pharmacare approach was pushed by very knowledgeable people and was integrated model that made a lot of sense. And when it went and turned into a reality, it was better than nothing, but it was still gutted from a whole lot of important principles. So having the federal government to lead the way also involved lots of politics. And in the current environment, it's hard to keep the core of what we want to achieve without interest group just like gutting the system. And I would say we also would need a federal government which is left leaning. And well, I'm not sure
Well,
if
do you
it works.
actually require a government to be left leaning, or at least a government that is concerned with accountability, so that if they set a particular policy direction, that it doesn't get diluted and diluted and diluted? The role of municipal governments.
What the municipal level adds to the equation, and that is central, is fine-grained knowledge of the needs and the resources and the capacity to like make local sense. And we've seen this in BC in a very local way. Like in the west shore of Victoria, there are new suburbs, lots of new families, very poor access to primary care system. And we had the municipality just open a medical clinic and said to the doctors, we're going to pay the overheads and the rents, just come to work for us, like La Grande Séduction, the Quebec movie. And it worked. In the same way, Nanaimo was amazingly successful at attracting US doctors because of local engagement with like, come work here and it's going to be amazing and we'll connect you. So fine integrated local movements are important. However, and this is where you cannot still expect municipalities to be the leaders of this, is that you need provinces or feds to make sure that it doesn't turn out to be just like wealthiest neighborhood, wealthiest communities paying for their own residents an above average experience while, poorest neighborhoods are just left out to hang. And this is where in all successful system where the municipalities play a core role, there is a peer equation system where money is being transferred from the richest to the poorest. And this is not going to be something that the municipality themselves put forward. It rests on provinces and the federal government being involved. So are we going to see this happening again? We would need a vision. I haven't seen it. We would need a political party that accepts to take risk. I haven't heard about it. And we would need a commitment. Currently Canada is saying we are going to massively invest in defense. That's a social choice. It is billions of dollars. We are making that choice as a society. I haven't heard the exact same sentence. We are going to invest massively in healthcare because that's a need. That would be a different social choice.
If you have the hub and you say there's no boundaries on the capacity in that hub in terms of professions and stuff. So obviously you need rehab. For a lot, you need some mental health. Basic things like a nutritional assessment and a home assessment for risk factors and so on. I mean, again, it's not much beyond common sense, but it's in short supply. And we keep circling back to primary care because if it's a mandate of primary care to do that, the chances are better it's going to get done. If you say you can do that, but you don't have to do that, it's not the standard model. It'll be as idiosyncratic as it is now. Some people will get lucky, some people won't. Mm-hmm. And the other part about the money, I mean, as far as taxing the rich, which in general I support, but the rich are already taxing themselves here, right? And it's not just the rich, like it's prosperous people have bought their way out of the public system.
I would argue that point. Where the wealth is concentrated is not like a demographic group. The 0.1% of the wealthiest Canadians, and that is 16,000 households. It is a tiny group. Think about a small rural village. This is the size.
Yeah.
That group, the 0.1%, have as much wealth as half the Canadian population. So yes. The wealth, it is extremely concentrated. And when I'm saying tax the rich, I'm saying we need a wealth tax and we need to tax the billionaires. And a society that believes that the feudal capitalist system can provide decent healthcare to all its population, it is fooling itself. It is not true. If we want feudal capitalism full of a tiny group of billionaires having everything and the rest having nothing, well, that society is not going to provide a universal healthcare system. It is not. And if that's the society we want to build, then we're screwed.
I think, yes, there's a lot of wealth in the baby boom generation, absolutely from a generational perspective, but I think that might be a bit of a red herring. That's great, Damien. Thank you so much. I really appreciate it.
Thanks, Damien. This was cool.